Right, breathe in, breathe out. Ready, breathe in, breathe out. Right, if you just breathe in for me, breathe out, and well done. Hi again, Mike here, owner for New Body Health and Fitness, and also an experienced lecturer, researcher, teacher, and so on and so forth in this kind of stuff for many, many, many years now. Okay, so I am going to address a topic I get asked quite a lot when I work with and from lots of rehabilitation patients and clients that I've worked with. So this is mainly from what we call the musculoskeletal perspective. Musculoskeletal rehab, that stands for muscles and obviously the skeletal system, muscles connecting into your bones. And common things with that would be your back injuries, your knees, and so on and so forth. And that would be pre or post surgery, any joint issues you tend to experience. So let's cut straight to the chase. The question I get asked is, Mike, I've been to the chiropractor for many, many years. Are they any good, or is it any use? Or I've seen the chiropractor for the last few months now. When I see them, the problem tends to feel a bit better, and then the problem tends to come back. I've seen this specialist, that specialist, and they've had the problem recur and repeat over many, many years. And it's kind of been a bit of a downward cycle for them. It's not really ever got any better, and it's kind of understandably made them lose a lot of faith in that rehab in general. So let's get straight to it. And spoiler alert, I'm not going to be unprofessional about this or disrespecting any other specialism, because at the end of the day, that's not what I'm here for. I'm here to give the science and the research behind that and the anatomy behind it as well. So let's start with the anatomy. So again, musculoskeletal rehab, focusing on chiropractic treatment today. When I talk to my patients about rehabilitation, I tell them that anything like that typically tends to be one piece of what I call the rehabilitation puzzle. So let's look at the anatomy. Here's a skeleton right there. And on this skeleton, obviously not this particular one, but if this was an alive person, we have muscle. So let's look at this arm here, because it's the simplest example to give when I teach my students as well. So there'd be a biceps muscle come down here from here, and it would obviously always cross at least one joint and come across, because muscles pull on bones. They contract and shorten to pull on bones to move them. Okay, so hopefully that makes sense. I always say imagine like an elastic band or something like that. So imagine an elastic band from here to here, or a rope. You pull on that, it will then pull this arm up, which is why they must always cross a joint. Those muscles, they are told how to contract and pull on those joints via something we call the nervous system. So the nervous system gives that muscle a set of instructions based on what that nervous system has learned, based on the input, which will be your habits over the years, how you sit, how you walk, how you move, how you learned and trained in a particular sport, for example, how you do that tennis swing, how you kick that ball in football, how you sit at the desk. Your nervous system will give those muscles that input based on what it knows. So if the nervous system are giving those muscles perhaps not necessarily the best signals to move and pull on those bones to make them move, to effect that movement, then over time it may lead to a potential sort of wear and tear or a potential injury or something, or it may make you more prone to an injury. I'm not going to say it definitely will, because the body's also very clever and very good at adapting to how you move as well. But if your muscles are receiving quite inaccurate instructions to the nervous system, your movement patterns really aren't quite right, then yes, you are potentially more at risk of various injuries and little niggles and all of that kind of stuff. Then there comes into play the fact that we take paracetamol, anti-inflammatories, and all of this kind of stuff, which is very counterproductive, because what we're effectively doing is lowering our pain threshold and tolerance to that pain. So when we get that pain again, every time we dampen it and we lower it, we dampen it with analgesics like paracetamol and stuff, and anti-inflammatories to stop the healing process, so it keeps coming back, because inflammation is not always bad, it's part of the healing process. But what we're doing is we're lowering our pain tolerance threshold as well. So any pain signal our brain now gets is going to be way worse than what it actually is. So you might even think the injury is worse than what it is too. So it's all kind of quite a vicious cycle. So let's get to a chiropractor. If a chiropractor, you go see them, those muscles have been pulling on those joints, and there's a bit of wear and tear. Perhaps you've got a scoliotic spine, mildly scoliotic spine, mostly due to not necessarily something you were born with, maybe due to the way you sit, move, all of that kind of stuff over a period of years. Normally you find it around about the lumbar spine towards the hips, bit of a sort of malalignment or whatever. And they do a bit of crack in place, or your neck aches or something. bit of crack, bit of what we call manipulation, pop a bone and a joint back into place and help realign that. Then with a good chiropractor, then that does most certainly help. However, it isn't the permanent solution. So the problem is a lot of the patients I'm seeing is they're seeing the chiropractor, crack, back into place, quite expensive, not knocking them, whatever, quite expensive. Then as soon as they leave the facility, if they've not perhaps been given a corrective exercise program or education on how to move from the chiropractor, which does happen. I'm not just saying that's chiropractors. You in any trade, you get people that are really good and people that are perhaps not so good and somewhere in between. So let's say in this instance, they've not been given the correct movement advice or any advice at all. Now, as soon as they start walking around in the world, the nervous system hasn't been educated. It hasn't learned any different because you've been cracked back into place. You've been manipulated back into place. So it's still going to give those muscles the incorrect signals. Those muscles are now going to start pulling on these bones in the same way they always have, especially obviously around here and up here and around here. They're going to start pulling on those bones and those joints in incorrect movement patterns, and you're going to start to come out of place again. I'm not going to say, I mean, it's not as simple as that, but let's keep it there for now. You're going to come back out of place again. Back you go to the chiropractor again. That's why I say they are one piece of the rehabilitation puzzle. The permanent solution is educating your nervous system through correct movement patterns. So unlearning incorrect movement patterns, relearning correct movement patterns, better posture, better habits in your daily lifestyle. At the same time as that, whilst you're re-educating your nervous system, it's also about improving that strength, that mobility. So it's not all just about strength. I've had people come to me and say, I've got a bad back, let's just strengthen up the muscles. Really not simple as that. We need to re-educate the correct movement patterns first. We need to improve the mobility, the flexibility, and all of those bits and pieces, and work on the strength at the same time. All of that only happens through movement. Your nervous system will only learn correct movement patterns if you are moving correctly, if you are unlearning incorrect movement patterns and habits and relearning new habits and correct movement patterns. That's the only permanent solution. Having your bones cracked into place or going for a sports massage or whatever will most certainly help in the interim period, almost immediately after that particular treatment. Get down to a place like this, have some proper guidance, and have some corrective exercise, corrective movement therapies. That is the permanent solution. Something like chiropractic treatment, sports massage, various other treatments as well, acupuncture, so on and so forth, will most certainly complement it, and it will most certainly make you move better in that short-term period after. But if you have that and only that, you can pretty much 100% be guaranteed that your injury or your niggle will come back. It will rear its ugly head again. Back down you go, spend more money, temporary relief, back down you go again. Let's save your money, let's save your time, let's go get the manipulation, go get that massage therapy, go get whatever. Come down to a place like this, learn how to move properly, and let's address the issue on a permanent basis. And guess what? You're going to have a whole load of other benefits at the same time. Psychological benefits, weight loss, if that's your goal, improved muscle tone and mass, and strength gains, and a whole lot of other things. You'll get the bug for it. And you'll be doing it in a social environment and saving a heck of a lot of money. No brainer. Any questions, or you need any more clarification or information on that, or you'd like me to post some research or anything that I've been a part of or have looked at myself, then please feel free to ask. Not a problem. Any more questions for me that you want me to address in another video, again, please do ask. I'll be here to address the questions, and I don't mess about. I have no problems with calling things out or putting it how it is as diplomatically as I can. Fingers crossed.